my name is Dr. Morgan Duval. I'm a doctor of physical therapy, and today I'm going to walk you through 3 specific exercises that you can do to help improve your posture. Now, we're going to be using a half foam roll just like this one, but before we get started, let's talk about posture. Does this position look familiar to you? Maybe if you sit at a computer all day or in a boring meeting. So many of us find ourselves in this particular position. And this position, this hunched over position, it offers 3 opportunities for nerve compression, which can lead to long-term dysfunction and pain. The first opportunity is at the shoulder. You actually have a bundle of nerves right here in the front of your shoulder. Your humerus, which is your upper arm bone, fits into your capsule right here behind where that bundle of nerves is. So if you're hunched forwards and your humerus is jutting forwards to the front of the shoulder capsule, well, guess what? It's putting compression on those nerves. Second spot that you can get nerve compression. Look at how rounded my thoracic spine is. That's the mid-back. When your thoracic spine rounds over like this, it actually pushes the discs towards the posterior aspect of your vertebra here. And you have a bunch of nerves along the posterior vertebra. So the discs get pushed backwards because of the pressure going back, and they can actually compress nerves as well, leading to pain, discomfort, tingling, long-term lack of function. Now, thirdly, watch what happens at my neck, right? My chin juts forwards in this position, and my neck kind of gets squished here. So now the pressure is going forwards, but the vertebra and the neck are actually closing posteriorly right here, and they also have the potential to compress nerves over time. So you've got cervical spine, thoracic, and shoulder, 3 places where your nerves can get compressed. And we all know that nerves do not like to be compressed. They like to have a lot of space. They like to move freely. Any compression can lead to tingling, numbness, pain, and lack of function. So highly recommend that you try to stay out of this posture here, right? And also do these few exercises to help minimize this postural formation of your spine. Okay, so let's get to it, right? You will take your foam roller and you will place it along the back of a chair so it lines up and down your spine, okay? Now you might have to readjust a little bit. It's not all the way down to my glutes. It's a little bit higher than that. I want it to be lined up the back of my spine. Hands in your lap. I want you to very carefully watch my shoulder here. What I want you to do is pinch the foam roller with your shoulder blades and try to draw your humerus posteriorly. That's backwards, right? So you're gonna squeeze those shoulder blades and then release. Squeeze and release. Now here's what I don't want. I do not want you to pull your elbows backwards behind your body, because watch what's happening to the shoulder, right? It's actually pushing forwards, which, remember, that's the opposite of what we want. That's putting more compression on the nerves here in the anterior capsule. So you actually are doing more harm than good if you pull your shoulders behind your back. So make sure that, or rather if you pull your elbows behind your back. So make sure that those elbows stay in front of your body. You can place your hands on your thighs. Just squeeze the shoulder blades together. Maybe even think about sticking out your chest a little bit as you do this, okay? So that, my friends, is exercise number 1, all right? Now exercise number 2 is very similar to exercise number 1. I want you to pin your elbows into your rib cage, and you're gonna keep your elbows here, okay? So your elbows are not going to move at all. Palms are facing upwards. You can use a TheraBand with this exercise, but I recommend trying it without a TheraBand first. All right, now from here, you're going to do the same exact thing with your shoulders, where you pinch your shoulders around that foam roller and then open your hands towards the outside, okay? You're actually gonna try to rotate your thumbs down towards the floor outwardly, and you should feel a pretty big compression in between your shoulders as you do this, okay? So open up, squeeze, rest. I'm running into the wall here with my right arm, so make sure you're not sitting next to a wall, but you do get the idea, all right? Really trying to pinch that foam roller. All right, that was exercise number 2. Exercise number 3. Take your foam roller and change its orientation so it is now going to be horizontal. It should be pretty much right at the bottom of where your shoulder blades are, right? So it should kind of feel like, when you have it positioned correctly, it should feel like it's pressing your chest forwards. And you might have to play with it a little bit to get it in the exact right spot. But once you get it set up, you'll bring your hands behind your head and open your elbows, okay? Make sure your elbows stay open so you are once again squeezing your shoulder blades together. You will then lift your chest and bring your gaze up towards the ceiling, arching over the half foam roller. Now, what I do not want is I do not want this, right? Because, yeah, sure, you're looking up at the sky, but look at what's happening at your neck, right? It's the same thing as this position we talked about avoiding. So you do not want to compress your neck in the back aspect here. Rather, keep your neck neutral and do look up at the sky, but make sure that you're hinging from your shoulder blades right where that half foam roll is, not hinging from your neck, right? So this is no, and this is yes. Squeeze your shoulder blades, open your elbows, really arch, and then slowly come back, okay? So how many do you do? Well, the short answer is you're gonna do as many as you can with perfect form and no symptom exacerbation. So if you do have any symptom exacerbation, you certainly do want to stop these exercises and speak with your physical therapist. Otherwise, try to do as many as you can, right? Really get into this. Open up your chest, engage your posterior chain muscles. These exercises, when done consistently and properly with good form, can truly make a big difference in your posture and your overall back health. All right, thank you so much for watching and have a lovely day.